Hi everybody, it's Dr. Wendy Fortna here on your weekly COVID update for the community of Hanna and surrounding areas. I have a couple of announcements today for you first before I get distracted and forget. The first one is if you have a lab or x-ray form and you are planning on coming to the hospital, you need to phone and book an appointment. We are working on getting a 1-800 number and or a website up and running so you can book it that way, but for now you have to call the hospital and book an appointment, and it's really just to keep you and your loved ones safe, making sure that we only have one person in the waiting room at any given time. The next announcement is that if you do have loved ones in our nursing home, also called our long-term care, and you need to drop off something for them, please do so during normal working hours. Monday to Friday, between about 8 o'clock and 4 o'clock, we have someone at the front who is screening visitors and is able to collect those packages from you. After hours, it gets a lot harder for us to do that in a safe fashion. You will notice that today I'm filming in front of our nursing home, and that's because I want to remind you that we do have accessible windows to all of the rooms in our nursing home, and even though you can't visit in person, it would be great for your loved one to see your face outside their window. We have people driving down, let's say from Stettler or maybe up from Brooks, to come and visit their loved one through the window, and it really does cheer them up. Another set of interesting questions that came this week were focused around social gatherings, and I specifically got one question asking me whether we should be avoiding gatherings of 2 to 8 people if all of them are healthy and social distancing rules are obeyed. And the answer is no, you shouldn't necessarily be avoiding them. You are certainly allowed to do things like walk around town staying 2 meters away from people. What about those garage parties or those driveway parties? Everyone sets up a lawn chair 2 meters from everybody else and you sit around and visit. Those are still officially allowed as long as there is less than 15 people. I think the difficulty with it is that when you get into a social situation, your desire to share beverages with people, to give them a hug, to shake hands is really hard to turn off. That's our natural instinct. But certainly if grandma and grandpa, want to come and see kids, as long as the kids aren't going to rush up and hug them, sit down, have a visit 2 meters away, bring your own chair and say hello. I don't see any reason why you can't do that, and that can really help to keep us sane, especially outside now in this beautiful weather. So go ahead and do that one. The next set of questions that I've had have been around pregnancy and COVID. And that's a little bit of a harder question. We don't have a lot of details because there just aren't that many pregnant women getting sick. Most of the data that we have right now is coming out of the United States and some of the older data from China. What we know is that pregnant women are at no greater risk than their non-pregnant counterparts. It is very different from influenza infection, H1N1, which preferentially and more severely affected pregnant women. With COVID, you are at no greater risk. So young, healthy people, while they can still acquire the infection, are less likely to have complications. We really don't have much data at all for the first trimester, so I can't tell you if it's going to affect rates of miscarriage or not. When it comes to the 3rd trimester and delivery, the latest study that I read out of the United States, with the caveat that our information and data changes regularly, is that there was really no increased risk to mom or baby if mom is COVID positive. I have a mixed feelings about telling that information because the advice I've been giving my own patients is that from 36 weeks onward, I really like them to self-isolate to give them every chance possible of being healthy at the time of their delivery. But really, you should be discussing that with whoever is going to deliver you and your baby. The last set of questions we've been having lately has been about visits to the hospital, and I did try to clarify that last time, but people who have a need for someone else there, so for example, someone with advanced dementia, they're going to have someone accompany them to the hospital, and we certainly are allowing that. For some of my language barrier patients, for example, English is not a language that they speak, of course they have to have someone with them, but we really do ask you to respect the policy that we're trying to limit the number of people entering our facility, and so as much as possible, every visit is for the patient and the patient alone. I think that's it for this week. Oh yes, I have had a number of people ask me about the map. If you look at it right now, if you look at the first section, it's going to tell you that there is one case in special areas. If you toggle over to the alternative view of the map, it's going to say no, there isn't a case in special areas. So I've taken a look at that myself, and I believe that the geographic boundaries that we consider special areas to be are a little bit different than what the government is showing on their website. And so from my understanding, that case is nowhere near the community of Hanna, and we still are COVID-free in our hospital. That's the best advice I can give you, other than to wash your hands, stay safe, and I will see you again next week.